Hello and welcome to Wellness Wednesday. I'm Deborah.
And I'm Rachel.
Woo! It's the third day of January, right?
Yes, of the new year.
Of 2024.
Yes,
Y'all, it's a blur. It's totally a blur.
It has been. And I've had heartburn since the new year started. So,
Well, that's because you turned that other number.
I said, I demand a restart to the year with all this heartburn.
Oh, Lord. It's because you got a year older, honey. You're in a new bracket.
know.
You're welcome to getting older.
I
it's
had
so
somebody,
much fun.
I made a Facebook post about borrowing Tums from my friend, and
I
then I
saw
had
that. I
somebody
meant to
else
say
say,
something.
wait till you turn your neck too
Oh.
fast and you can't move your head for a few
Honey.
days. I'm like, oh, no.
I
no,
warned
no,
you.
We're not.
Each segment, it gets a little worse. And mine's coming up in April, and I'm dreading it because I usually start falling apart right before my birthday. And then 2 days after, I level off. So I just got to make it through that first 2 weeks before my birthday, and I'll level off. That's what I have to look forward to.
And New Year's resolutions.
Uh-huh.
I'm pretty sure some of them that I had originally thought they've already
Went out the window. Yeah.
gone.
We had good intentions.
But
Really
still
good.
working on that. But fun things.
Okay.
I did look up some fun things.
Oh, Lord. No trivia. You know I
Now's
suck
the
at it.
time to check your batteries to your TV remote.
Huh.
Your smoke alarm batteries.
Yeah, we do that.
Like
Yeah.
anything that you would change batteries for.
It's
like
time.
certain dates, the beginning of the year, daylight savings is another time that they say to check those things. So maybe that, if you need to do some maintenance things.
This is a good time. This is a good time. And if you're free, please feel free to come to my house and help take down Christmas decorations because we're going to be doing that this weekend. Well, I did it today too. I had some at other places that I had to go take down. So, yeah.
I've taken down most of mine except for like my living room stuff, and that'll come down Saturday on the 6th.
Yeah,
So,
nothing's come down at our house. Nothing.
no, I still have my outside decoration, but my neighbors are still running their lights. So
Hey, why
I feel
not?
like as long as they still have theirs on, I'm
You're
good
ahead of the
right now.
game. Head of the game.
And they had way more than I did, so if they're still rolling, then I can still
Hey,
roll.
you know,
so that's okay.
who judges? Let's don't judge. Let's just live our lives and enjoy them.
No.
Tomorrow's not promised. We all know that. So, I'm going to get on my soapbox just a minute, and I've already told her, rein me back in if I get going too far. So, managed care. We all know I'm not a fan of it, and here's why. So, I've dealt with it in the last 2 days with referrals, and it breaks my heart. When I hear people, I have to choose food over meds or meds over food. And managed care helps me be able to afford it. But when you need help, and I'm not talking in the community, managed care is probably great in the community because it helps you pay for your medicines. It helps
you're
you
healthy.
If you're
That's
healthy,
the best
that's
way to say it. If
that
you're
is-
already
you are
healthy.
correct. So the way I explained it to the person I spoke with today, as soon as you start having those hospital visits and you see they're going to be reoccurring and you're going to need rehab or you're going to need skilled services or you need home health, that's when you need to look back at your traditional Medicare. Because with traditional Medicare, it gives you 100 days. The first 20 days is paid 100%. The 21st day, you will have a copay, but that's when you have a secondary insurance that'll help pay for that copay. And there's people out there that can help you. We can help you. I hate to see somebody in a circumstances, and I won't go into detail, but you know, when you're in a nursing home and a skilled, trying to get better, and you're getting denied by your insurance because they're saying it's time for you to go home, but you can't even get up and transfer out of your bed to a wheelchair. How is it time to go home? This is where I don't jive with managed care. I don't. I think it's broken. It needs to be revisited.
And that happens more often than not. Unfortunately, when everybody looks at the plans and sees the things,
The savings
they're like,
is
oh,
great.
this is great.
Yeah, it
it
saves
helps
me a lot of
with their
money.
medications and
Vision, dental, all of that. And I get it.
if you are a healthy person who's maybe still working part-time or you've just reached the age and you qualify so you're getting the insurance and you just need your regular visits, but somebody who unexpectedly has
Needs acute care.
yes, a heart attack and needs open heart surgery and ends up in rehab, has a fall and a broken hip, those are things that you never foresee coming.
You don't. We all are gonna believe we're gonna stay healthy, which, you know, God willing, I hope we do. But I'll give you an example. My husband just turned 65 in October. Sorry, honey, I let it out of the bag.
Poor guy.
I just throw him under the bus. He doesn't look 65. He went on Humana. We talked back and forth. I said, well, it's great in the community, but first time you have a couple of ER visits and hospital stays, we're going back to traditional. It is a federal program. It is done by the government. All of them are, but United Healthcare, Humana, Aetna, WellMed, all of those, that's under United Healthcare. All of those are managed cares, and they're for profit. They want to make a profit. So when you're in the hospital, you've had open heart surgery, you're not going to get the equivalent if you were on Medicare. I hate to tell you. They're going to go, oh, you're well enough, even if you're not. Mm-hmm. And I would love for somebody to argue with me about that, because I'm telling you, I see it too much. So there's where the difference is. Medicare is government also, but it's truly the government is managing it. And they give you 100 days. If you don't use those 100 days up, that's great. Fantastic. You have to have a well spell of 60 days. That means staying out of the emergency room, staying out of the hospital. Once you get past that wellness spell of 60 days, it resets back to 100. It's a great program. It is a little bit more expensive for your meds and things like that. I'm going to research Medicare versus your secondaries.
Yeah, well, you take out, if you would roll with traditional Part A covers your hospital stay. Mm-hmm. And that's basically what it covers. Mm-hmm. It will cover home health. It will cover hospice, but your doctor's appointments, things like that, have to go through your Part B. Mm-hmm. So that's where people tend to say, "Oh, well, this costs me more because you're paying for your Part B." And then if you want the insurance coverage for medications, then you have to go in with Medicare Part D. But there are all kinds of supplements that you can add to it.
You just got to ask the right
and things like
questions.
That. Mm-hmm.
I was talking to a case manager yesterday, and bless her heart, she's dealing with her mother, the same circumstances. And she says, Deborah, it's so expensive. I said, there has got to be a way that you can stay on traditional and still be able to get your supplement to be able to pay for your meds. And it can't be outrageous. And if somebody has the answer, please let me know.
Well, I think another thing that people don't realize is once you start waiving that Part B
and
the Part D, then you end up with a penalty when you do decide if you don't elect in the beginning.
You have to retro back to the day you signed up for A.
And at that point, if somebody's not educated enough in the beginning, when it's time for them to sign up, that's when it gets even more unaffordable.
It's more ridiculous. So. Well, I see a lot of veterans that they only elect to do A because they have veterans. Great. But then they realize, okay, for the acute care, I need different. But then when they have to retro back to when they actually took out that Part A, you got to pay all those premiums. I don't know about you, but I don't have it.
No, and especially somebody that's only bringing Social Security income in, they can't, because the little bit that they're bringing in, anywhere from $700 to maybe $2,200, $2,600, maybe. Their insurance premiums are coming out of that
prior
and then
to them
that's
getting the check. Yeah,
their whole income. So it is a lot. It's hard. It's very hard for the elderly to.
It's frustrating. I'm having to, and I've always been this person. I think outside the box. I try to come up with creative ways. My last job, I'm the negotiator. Well, if we can't do that, can we do this? Because I'm for who I'm trying to help. I'm for the company I work for. Don't get me wrong, but I am also that my job is to advocate for.
And at the end of the day, that's I think why you and I get along so well, because we're advocates.
Yeah, it just breaks my heart. But I'm going to jump off my soapbox again. If somebody has an answer, reach out to us. We'd love to have you on our podcast. We'd love to hear answers because I'm frustrated.
Yeah, and we did attend a luncheon today and got some really good information from a VSO
representative for the veteran.
From Miller County.
Yeah,
he had some good stuff.
He did.
We work with veterans all the time. We have a contract with the VA.
We do.
We're working on a We Honor Veterans program.
That'll be our next step.
We have all the things in place. We just got to get them submitted. So we're an actual partner. So you'll probably be seeing that logo rolling with Retreat here in the next few months. We'll have the We Honor Veterans. So we'll do some events throughout the year and stuff to work on that.
We're going to be out in the community a lot. Look for Retreat. I'm telling you, 2024 is going to be our year. It's going to be the year that we help our community with everything that we have under our umbrella. And if we don't have an umbrella, I'm telling you, it's probably coming.
And the easiest way to say it is looking at how this umbrella is. We believe somebody should be able to come on to service
A to Z
and get everything that they need from one company. So they're not having to reach out or look for different companies to come in.
We're your total resource.
Yeah,
We're going to be
everything you need. You can make one phone call and have it all there to help you. And if you've been on home health and you need home health again, then you know you can call back. And as even if you're trying to help keep your loved one at home, you know you can start with one program, and we can run you through our entire program and transition from one thing to the other, and you just have a good continuity of care. And you're still going to be dealing with the same administrative staff. We have so many people that work in our office. We're in our conference room today, and
this is a picture.
We
Downtown
have
post
all
office.
Texarkana things, but each person in the office that's behind the scenes outside of the clinicians,
They make it run smoothly for us.
They each play a role. So, and they know the patients because the clinicians come in and we meet every week and talk about the patients. So, when the referrals come in, they already, whoa, so-and-so is back. So everybody under the umbrella knows when a patient comes on, if we've had them before. It's just, it's a whole team working together. But there's a lot of moving parts to it. We're excited to be able to say, come get under our umbrella and let us take care of you.
Welcome.
So to be able to follow somebody through a healthcare journey, from, maybe just needing home health because we've got a new medication to,
IV antibiotics, wound care,
hospital stays and back out, and, palliative care and hospice and the inpatient hospice unit and, our own therapy team. It's a big umbrella, and there's exciting things to look forward to coming in 2024. And
it's going to be an amazing year, I think.
It is.
We're excited. We can't wait to roll it all out and to our community. If you have questions, concerns, reach out to us. I mean, I'll throw my cell phone number out there. I don't care. 903 908 I'm at that age. 4200. Call me, text me. With any questions or concerns, or hey, I would love to come on your show and talk to you about. I have the answers.
We haven't figured all these neat things out, but eventually we could just point. Dial to the number at the bottom of the screen. We'll get that figured out.
I'm not the technology
We're getting
person.
there.
She will be that person.
We are getting there. And so everybody knows, I hope you ate some black eyed peas and things for me, because I didn't.
I ate extra.
I did make some black eyed peas for everybody else, and I made.
You wouldn't take one?
Mm-mm. No, they smell horrible.
Well, just hold your nose and swallow.
Smell. I can't do it. I did have some cornbread and I had pork. But I had bacon wrapped jalapenos with the cream cheese. It was my pork.
Oh,
the bacon, that was my pork. That's how I had the pork.
We go to my brother's house, and thank God he feeds us. We had black eyed peas, cabbage, and all kinds. We had it all.
We had a pork butt, a brisket, and then those bacon wrapped peppers, baked beans, potato salad, black eyed peas.
No, the black eyed peas.
Not doing that.
He put something in it. He puts
you would have to put all kinds of things in it.
It tastes pretty good.
I even read, I bought a thing of fresh peas, and on the back of it, it said to put a can of cream of celery and to chop up celery and put in there. And I'm like, yeah, because celery sucks too and has this strong flavor to it, so you have to add all that. I'm not adding all that.
He puts Rotel tomatoes in his.
No,
but it was good. I mean, if I can eat it, because I don't like any of that kind of food. Now, they did make collard greens, and I didn't eat any of that.
My husband fried cabbage, and my house still smelled like fried cabbage yesterday. I opened the windows trying to get all that out. No.
But hey, if it helps me in this new year, I'm going to do it. So I did it. So God bless me. I hope it, we prosper into this year.
I had the cornbread. I don't know what the cornbread does, but I had the cornbread.
I think it's just part of the meal. I don't think it really has. I don't think it has a meaning to. I don't think.
I think I did read it's gold. The gold is supposed to be for money too. So maybe or luck.
Well, I had that too. I had that too.
I don't know, but February's coming up. It's besides Christmas, February's my favorite time of the year.
Oh Lord!
Because we go from Christmas tree cakes to king cakes. Now, king cakes is my jam. So as we're moving into Mardi Gras season, that's another exciting thing for us to look forward to. But king cakes is the next on my list.
I'm telling you, I love king cakes, but it is too rich.
No, I'm seeing a trend in my later days. It's all about cake. I think I'm a cake person today.
Well, sweets, as you get older, sweets become your life. I'm not gonna lie, because that's the last taste bud.
Yeah,
sweets.
But I get a cake from Elizabeth at the Flower Room here in town. She gets these king cakes from Shreveport and brings them back frozen, and they're tubs. and they're Tubbs king cake, and they are fabulous. And you can get like cinnamon and cream cheese, strawberry and cream cheese. Like she brings all kinds.
I've seen all kinds, yeah.
But I mean, she already knows. I'm already watching for her to post that she's
You're gonna have it ready for you. She'll have it ready for you.
Yep, I like
Delivery.
those. And what is the Cajun place here in town? The meat market.
You would ask me over on Arkansas side.
Yes,
I do not know the Langer.
I don't know, but they do like a donut king cake. So it's like little pieces. It's like donut holes basically that's sectioned off, and they make a king cake out of it, and it's pretty good too.
Oh,
and
now there.
It's good. It's not a Tubbs king cake, but it is good. So,
well, you know, anything out of Louisiana's got to be good.
Mm-hmm. Yeah.
So, but yeah, this is 2024. Whoo! Who would have thought it?
Cue the fireworks.
Yeah, I'm done with the fireworks. I have a corgi that's a little overweight. Yeah, I've never seen that dog move so fast when them fireworks go off. He knocked me down and hit it to the door.
Yeah.
So.
And I'm already looking at beach vacations. Like,
she is.
It's the time of year. Like, it's something. I have to have that first beach vacation booked with like the first half of
it gives you that satisfaction.
I need it
ready.
to look forward to. I need it to look forward to, and it gives me a whole 6 months to work on my tan, get
ready,
ready, as beach ready as I'm gonna get.
I'm gonna let you have it. I'm gonna let you have it. I mean, I love going to the beach. Don't get me wrong, but yeah, I don't. I've gotten to the point I just don't like to travel. I mean, I like my house. I want to stay in my house or my backyard.
I don't like the ride from here to there, but after I get there, I'm perfectly fine. And I don't ride in the car with my husband because he makes me car sick. So I drive with a group, and then he has a group, and I don't have to listen to his music. So by the time we get there, we've only had a few arguments, and normally that's about how he doesn't follow the directions.
He went off course.
Yes.
Well, my husband sent me a TikTok not too long ago about when you get married. Why is it when you get married, you can no longer drive? You have to have that person in the seat next to you giving you direction. I go, oh, that is true. You can't drive. How do you get around town without me?
I told my husband, I think it was Saturday. We had gone to play golf Saturday, and we were on our way home. And I said, why don't you drive like you did when we dated? Like you
were
drove
still starry-eyed.
like a very safe older man who was like very cautious. And now you drive like you're on Fast and Furious. This is backwards.
Well, my husband's a funeral director. He likes to tailgate people. I'm like, buddy, we're not in a funeral procession. They're going to slam on their brakes. He goes, no, they're not. I'm like, drug back up. I do not like, and especially with lights on at night. I'm like, honey, they're going to get out and they're going to be ugly. So back off.
Yeah.
But anyway, we're gonna keep going with our Wellness Wednesday. We will have a person next week. We kind of today was kind of a crazy day between taking down trees, working referrals. Our social worker was going to be on with us today, but we kind of messed her up and changed the time. So next week she will be with us next week, Regina. Look forward to hearing what she does out in the community for our patients and other ideas or suggestions she may have for you for resources.
And just explain a little bit what social workers do, because I always tell people when you say, "Oh, you get a social worker," it's always this look on their face, and it's normally it's because there's intrusive questions. If you're not expecting it, that what they're asking, but once you know the why behind why they're asking, it's a little easier. It's not because they're being nosy.
Yeah.
Like I had a patient call me one time that had requested a social worker. And it was a home health patient. So the social worker goes out, she does her questionnaire, and then he calls and he said, I really don't want that lady back at my house.
Too many things.
And he requested her to come. And I said, why? You know, what's wrong? And he said, she wanted to know where I slept. She wanted to know where everybody slept. And it was for the emergency preparedness plan. So once I explained to him,
it's not because she cares where you sleep. It's just for their,
Yeah. So
they do ask a lot of questions, but it's not because they need to know all this. It's because they want to make sure you're prepared if something does happen. They do have a lot of resources out there. Both of us we're not licensed social workers, but with the different companies we work for, we've had to jump into those shoes, and those are not easy shoes to fill. Because you do have to do a lot of you have to know your community and what's out there to be able to help people.
At the end of the day, it's just a determination of wanting to help somebody and make sure that they're in the right place at the right time, getting the right care. You end up putting on many hats to get there.
Lord,
and we're thankful we do have a social worker to.
Yes, we love that we have a social worker that has got our backs and out there helping us in the community. And I love sending those checks. Can you go check on? Will you go do this for us? So, but this we're going to wrap it up today, short and sweet. But welcome to 2024.
Right. And,
Stay tuned to what
yes.
Retreat has coming on board with us.
Yep.
It'll be fun.
Thanks for spending your Wednesday afternoon with us.
Bye.
Have a great week. Bye.
Choose excellence in healthcare. Choose Retreat Healthcare Services.